Hi, my name is Jacqueline Pegram, and my PICO question is, in neonates, how does breast milk compared to sucrose pacifiers affect pain management? In adults, we often use pharmacological means to manage pain. In neonates, that isn't possible. There are many adverse side effects that neonates experience, as well as questionable efficacy in babies. When comparing breast milk to sucrose pacifiers, we often have an issue with supply. Not all mothers want to breastfeed, and therefore we do not always have breast milk to use. Lastly, not all facilities want to manage pain in neonates, as pain management takes time and costs money. So why is it important that we manage pain? Neonates are a vulnerable population and cannot speak up for themselves. Therefore, it is our job to speak up for them. Neonates experience many painful procedures shortly after birth. For example, in the state of Kentucky, every baby born must undergo a metabolic screen test, which requires a heel lance. On top of that, they will often undergo at least one glucose test, but many more usually, as well as lab work. Pain can impact a neonate's behavior, physiological state, or metabolic processes. It can have many long-term side effects on infants that can be associated with abnormal neuroendocrine and immune responses to stress. Prolonged pain can evoke changes in the structure and functions of the developing nervous system, depending on the moment, location, and kind of painful stimulus. When looking at literature, I looked at the most recent literature or literature that was most prevalent throughout all literature that has been completed. All of the research that was used was done doing randomized controlled trials. Bueno et al. In 2012 compared breast milk and sucrose in pain management of neonates. They used the Premature Infant Pain Profile Scale to determine the pain scores of infants and determined that sucrose was the most effective in managing pain. Yang et al. In 2012 did a randomized controlled trial and compared water, glucose, and breast milk in pain management in neonates. Using the neonatal pain, agitation, and sedation score, infants were given a score based on their pain management after given the solution. The results showed that sucrose was most effective in managing pain. Sahu et al. In 2013 completed a randomized controlled trial and compared water, breast milk, and dextrose. Infants were given a PIP score after a painful procedure, and it was determined that sucrose was most effective in managing pain. Simons et al. In 2012 did a randomized controlled trial and compared breast milk and sucrose. After a heel lance, a PIP score was given to infants, and it was determined that sucrose was most effective in managing pain. Haye et al. In 2004 did a randomized controlled trial and compared breast milk and water in pain management in neonates. It was determined that breast milk was more effective than water in managing pain in neonates. Shah et al. Did a literature review and compared many randomized controlled trial and quasi-randomized controlled trials. They determined that sucrose, above all pain management techniques, was most effective in managing pain. So what does this mean? Sucrose is most effective at lowering pain in neonates based on infant pain scores, time to first cry, and duration of cry time. Breast milk is an effective pain management technique, but is not as effective as sucrose. So how can we use this? Research has shown that sucrose is effective in lowering pain in neonates and should be used during painful procedures in order to decrease long-term side effects of pain. So please speak up for your babies and manage their pain. Thank you.